So thank you very much and good evening everyone. It's good to be here. I didn't anticipate it to be quite so warm though. I'm a doctor by background, I'm a psychiatrist. I spent most of my professional career in the field of forensic mental health, and I joined Southern back in November last year. And I suppose like Penny's Trust, we too have been through a huge amount of change. I'm sure many of you are aware of Southern's recent history, which has been checkered to say the least. And we're very aware of the failures of the past and the need to improve. If I may, let me sort of just outline to you the scale of the organisation, because not everyone realises that we are an integrated trust. We provide both community physical health services, including what is essentially a small district general hospital in Livingston, and a whole range of mental health services. And last year we treated 280,000 different patients. We provided nearly 100,000 outpatient appointments and had nearly 1.5 million patient contacts, so a huge amount of activity. And what I would say is that in the vast majority of those cases, we got things right. But there are occasions when we're still not getting things right, and we're very aware of the need to improve. And that's why there has been so much change, and change which is ongoing. We have a virtually brand new senior leadership team in place. We're also investing in quality improvement, which has been touched on already by one of the panellists. And to do that, we partnered with one of the country's best providers of mental health services, a trust in the North East of England called Northumberland Tyne and Weir, which is rated as outstanding by the CQC. And for about a decade now, they have been using quality improvement methodology that they learned from one of the best hospitals in the United States of America. So we're very keen to follow in their footsteps, and for about 10 months now we've been working with the Trust, and they're training our staff in this quality improvement approach, and we're now starting to see the benefits of that. And a great example of that is pretty close to here. It relates to the work we've been doing in the Portsmouth and South East Hampshire area, in conjunction with SOLN, the other mental health provider organisation, and in conjunction with our patients, our carers, and a variety of other stakeholders, including the third sector, by which I mean the voluntary sector. And essentially together we have redesigned how we deliver crisis mental health services in that area, how we can improve access to those services, particularly out of hours, and how we can pool our limited resource. So the two trusts are coming together, combining their crisis services, so we can make the service so much more responsive and more effective. And I think that's a really exciting development, and it's one we hope now to roll out across all of our patch, so across all the county of Hampshire. In terms of community services, and I touched on our plans earlier in response to the lady's question, there had been a lot of uncertainty regarding where our community services sit going forward. And indeed there were plans for Southern to lose its community services and for them to go out to tender. Those were plans that we felt were not right, and not right for our patients. Because our patients don't just have mental health problems and physical health problems, they often have a combination of the two. So the direction of travel, as I see it, as we see it, is to deliver more joined up services. And I'm very pleased to say that our commissioners now aligned with that view, with that vision, and we've just signed something called a Memorandum of Understanding, which sounds very grand, but essentially it's a commitment to work together to look at how we can transform our services. And we've got a set of objectives that we need to achieve by the end of this financial year. And we're very excited by that, and we're very confident that we can build on some of the work that's being described by our GP colleagues and ensure that our services are more closely embedded with primary care, so we can deliver more comprehensive care to people who need community physical health services in particular. So again, that's a really exciting development, and I'm really optimistic about what that will mean for patients who use our services across not just this patch, but across all of Hampshire. We too have been visited by the Care Quality Commission. They carried out a comprehensive inspection of our services over the summer. We are awaiting the final report. What do we think that will say? Well, I think it will highlight that some of our services have improved from when the CQC were last with us, and I'm pretty confident that they will find lots of evidence of improvement. But I'm also very much a realist. I'm aware that we are not the organisation we want to be, and I'm confident the CQC will also find areas where we need to improve, and improve we will. And I'm confident that over the next 12 to 24 months you will see major changes, major improvements in the the services provided to the population by Southern Health. There's a lot to do, but I'm very confident we have the organisation that will be able to do that and provide you with the services that you deserve. Thank you.